Welcome to our discussion today titled What You Need to Know About HIPAA Security and Privacy Compliance in 2021. A lot has changed. A few things worth mentioning. We are recording this webinar and we'll send the link for those that may have missed this or maybe joining us a little later. Also, please feel free to answer or ask questions in the chat area. We'll do our best to answer those questions as we get to them. Try to get to them real time, but we'll have some time. Hopefully at the end we can address some of the questions you have as well. And we do have a few poll questions as we go through this to keep you engaged and to see where you are as organizations. We've got a lot of different types of organizations joining us today. A lot of large hospitals, some clinics, some business associates. So we will do our best to get to as much information, as valuable information as we can. So let's get started here. My name is Bobby Sigmiller. I'm one of the co-founders of HIPAA One. I've been here for a really long time, it feels like, but it's been good. We do a lot of these webinars and excited to be joined today by Vikas. He's the Chief Digital Health Security Officer for Enterprise Health. Vikas? I think he's on mute.
Yes, of course, I did it. I was on mute, but thank you, Bobby. Great to be with you today and talking to all of our attendees about some really interesting topics. So thank you for inviting me.
Glad you're here. And I could hear him through the airwaves, even though he wasn't speaking on mute there. So we have a lot of, as I mentioned a little earlier, a lot of hospitals on the call today. You may work with small practices, clinics, business associates. We're going to dive deep into some areas of HIPAA compliance, privacy, security, and then keep it surface level. Obviously, we can't cover everything in an hour here, but we're going to do our best. So there's been some updates to the Stark laws, the safe harbor. What is that? How does that apply to us? What are some of the proposed changes to the privacy rule? We want to hit on some of those areas. Also understanding what are your responsibilities as a practice, as a hospital, as a business associate. You do different things. What are your responsibilities? Where can you get into a little bit of trouble? And how can we avoid some of those pitfalls? So we're going to share a little bit of that today. Common mistakes organizations make when performing or undertaking their security risk analysis. We see it all the time. We've got about 8,000 client sites that do this each year. And they range from really, really small practices, single physician practices, all the way up to very, very large health plans, 20, 30,000 employee plus organizations. And then hospital health systems that have hundreds of locations. So they're all different, but we see some common mistakes within those organizations. And then finally, what are some of the approaches to performing this annual SRA? So this is the first poll question I want to ask. We always ask this. I'm going to tee that up for you here. Got a lot going on. So what best describes your current role? And the reason I like to ask these questions, I want to see where you are as an organization, who you are as an organization, so that we can tailor this discussion to you. And I'll show you some of the results. Some are private, and I won't display any private information here. But want to understand, are we administrative staff? Are we IT or HIPAA compliance? We always get a different mix on every webinar we have, and I know different topics are more relevant and interesting than others, but just give about 5 more seconds and I am going to close the poll here and display the results. So share the results here. So it looks like 70% are HIPAA compliance or data security. I love it. Sometimes it's clinical staff. We get the administrative staff on and they want to learn about some things. So we can tailor a lot of our discussion. We do have some administrative and EHR IT, so that's good. Thank you for that. We want to talk about some of the changes. So I'll have Akash share some, on the Stark Law, the final rule, what's changed. But before he does that, I want to point out a buzzword that you may start hearing more and more and more of, and that is adopting a framework. We're going to specifically talk about what that means throughout the course of this discussion, but adopting a framework, what is a framework? Why do I need it? Well, there's some laws that have changed that are really encouraging you to do that so that the penalties and the risk to your organization are decreased. So Vikas, if you'll share some of the changes to the Stark Law final rule.
Sure. Thank you very much, Bobby. And certainly, first of all, before we even get going, I just want to say how thrilled we are as Enterprise Health to now really be one family with HIPAA One, with the recent acquisition back in December of the HIPAA One platform and organization. So we're really one big family now, if that wasn't clear, so under Enterprise Health. So just want to identify that. But yeah, Stark, I believe since 70% of the folks on this call are in the compliance or security space, probably you've been following some of this. So I'll cover this at a high level and maybe give you some of my takeaways from it. But late last fall, there was a change, an amendment made to the Stark laws. And fundamentally what it allowed to have happen was health systems, hospitals, and their community providers, it allowed them to work closer together, specifically on cybersecurity, without the fear of overstepping Stark. And so this was basically the ability to share technology where reasonable and appropriate, as well as provide services or even consultation amongst sort of the community of healthcare providers and health systems in a particular region, without that fear, again, of overstepping any laws or any regulations. Now, I still would recommend that anybody that is taking advantage of the exception and the safe harbor here certainly talk to their legal counsel about the plans that they have and how they plan to work with their community of providers. But this was something that was sort of a bellwether, if you will, kind of like everybody took notice. Okay, this is interesting, this kind of a change. And then, Bobby, if you go to the next slide, it closely on the heels of the Stark Law, we saw earlier this year in January a safe harbor to the HIPAA high-tech rule. So that was another really interesting sort of indicator of where the federal government at the public sector was really trying to sort of move the needle and carrots and sticks. And, you know, that is a term I'll use a few different times, but I really do see that at the federal level, there is this sort of carrot and stick approach that's going on. Bobby mentioned before frameworks. I think probably not uncommon or unheard of to a lot of you, but certainly the concept of what I like to call holistic frameworks is something that's really, really important. And this safe harbor that was put out, really, if you read through it, things like the implementation of security best practices for the course of 12 months, the carrot here of either no audit or decreased sort of focus, intensity of the audit, or potentially even fines. Again, I think to the majority in the industry, we saw this as really the federal government wanting to incent healthcare organizations to take a holistic approach to their security program, to holistically adopt frameworks, if you will. And I don't think the timing is sort of by happenstance or coincidence. We know everything that's going on in the world of ransomware. I'll give you an interesting stat that I just ran across the other day as we'll move to a later slide. So this particular safe harbor, I think, continues to build upon what we saw with Stark. Bobby, let's go to the next slide. Now, something that's more recently has happened and went into effect April 5th was the information blocking regulations. So information blocking, what to me fundamentally, as you read, you know, crazy as I am, I actually like to read this stuff. As you read the regulations, really fundamentally what it's trying to do is provide data to patients in a reasonable and timely fashion. And also according to standards, something that isn't being talked about very much, but we implement in 2022, sort of new emerging or modified standards as to how that information can be shared. So fundamentally, the data can't be held captive. I think that's fundamentally what they're trying to achieve with information blocking. And there's a term that they use called actors. So similar to HIPAA, where we talk about covered entities as a defined term, which majority of you are, or business associates, which a lot of you are. In the information blocking regulations, there's a term that they use called actors. And what actors are healthcare providers, health IT developers, health information exchanges, or networks. Basically all the places that patient data resides is stored, is transmitted, is processed, and the folks that are responsible for all of that. What I don't think people are paying close enough attention to is sort of the smaller community. That's a very broad part of the digital health ecosystem. And so those smaller players and the things that they will have to do to comply really by 2022 to all the requirements, both from a timeliness standpoint as well as with data standards, I think we're probably going to see a little bit of consolidation in the specifically around the EHR space, the smaller vendors, but generally in the digital health space as well, where we're really holding that patient data. So this has started now, this sort of move, and Bobby, you can go to the next slide, around really thinking about privacy, right? So the focus has been very much broadly on health systems and providers, and then more recently we're starting to see the focus with information blocking and the proposed changes that you might have heard of to the HIPAA privacy rule around patients' rights and the rights to their data. The ability to, one, not hold the data hostage, but also to further protect, as we see the dissemination, the decentralization and federation of healthcare data out there, to really give patients that comfort of knowing that their data is being kept private. So as we look at all of this so this is at the federal level, and Bobby, if you go to the next slide, we'll kind of see that trend continue at the state level. So starting with California and Texas, sort of early adopters of GDPR-like consumer privacy requirements and patient rights requirements, we're now seeing across the country more and more states adopting a CCPA kind of regulation or requirement within their state, not listed here, but Washington most recently was the latest state to add this as well. As it's to be ratified, I believe, later in the year. But as you can see, and I think the trend will continue. So we're seeing, again, these macro level trends where we're really enforcing security, privacy, compliance in this holistic fashion, and in a way that where compliance, framework adoption, and what I like to call resilient risk management are really unified along this continuum. So that picture is starting to really take shape at the federal level, how they want this to progress. And I see what we're seeing in the private community, in the private sector, is really the reaction of all of this through these what I see is to be much more highly optimized programs, again along the path of compliance, framework adoption, as well as resilient risk management.
Thank you, Vikas. So you can see a lot of changes that have happened in, state and federal, different laws that you need to be on top of, and that framework is very important. So I do have another poll question. So here we go, going to launch that. Have you adopted a cybersecurity framework? Is this something that's new to you, basically, or have you already done something? And again, there is nobody's going to be reported here on the call. So I want to show you where the industry stands across the nation. Vikas is actually on the East Coast, I'm on the West Coast. So it's interesting, the different locations, the different responses we'll get. So I'm gonna close the poll here in about 5 seconds. So if you haven't answered, just go ahead and click. And I think you'll find this interesting. So 80%, close to 80%, so 76% have adopted a framework. That is incredible. So virtual pat on the back. Hopefully you can pat yourself on the back right now for doing that, because that is going to help your organization in a big way if there's a breach, if there's an audit. The fact that you've adopted a framework is going to help in the leniency side of the house. When that auditor is identifying what you have, what you don't have, that's going to help quite a bit. So congratulations on that. Moving and shifting gears to another topic, we're seeing a huge problem with data breaches and HIPAA violations. They're becoming commonplace. Why do they keep happening? It's like, we know they're out there. I've had a few letters that I personally received from LabCorp and a local clinic that said, hey, sorry, your information has been accessed by hackers, and it's frustrating, very frustrating. Why is it continued happening? We're finding that security measures, the frameworks that we're talking about today, and you can look at your organization as a home, the doors and the windows are being left open. We even find in some scenarios, employees are literally holding the back door open for these cyber terrorists. So this is why it's important to complete that comprehensive security risk analysis. It's huge. You've got to make sure you do that every year. It's going to help you identify the gaps in compliance. Where are you at risk? What are the windows that we're leaving open? What are the doors that we're leaving open? And then it helps you put a corrective action plan in place to prioritize what are my high risks. Let's focus on those first and work the way down the list. Now, HIPAA compliance is unique in that once you identify your gaps and put a plan in place, you're now HIPAA compliant. Even though you haven't remediated anything, you're HIPAA compliant. So very important that you put measures in place to help protect your organization. So Vikas, talk to us about some of the cyber attacks. How do they protect their organization?
Well, it's interesting. I just want to comment on the poll that we just did around frameworks. So I think if we had done that same poll about 5 years ago, those percentages probably would have been inverted. So we're really seeing the progress of the industry in moving towards this sort of holistic continuum around security and privacy. So I think this is all stuff we know. Interesting stat that I came across the other day was that 34% of all global healthcare providers, this would be hospital health systems primarily, were attacked or hit by ransomware just in the last year. So it's just sort of mind-boggling to me how the industry has been attacked. I know we see and hear the headlines all the time, but 34% of all hospitals, health systems globally were hit by ransomware last year. So that again, I think is just putting that incredible laser-like focus on doing things in a scalable way and then being holistic in how we do it. And I know later at the end of the presentation, we're going to talk a little bit about how to do this, how to really do risk assessments and risk management in a more scalable way. Bobby? Perfect,
thank you. So to Vikas's point, you talked about some of the attacks, and we have found over the years over 80% of the fines, this was just in 2020, were due to failure of properly conducting a security risk analysis. Not that they didn't do it, but they didn't do it appropriately. And as a result, the year prior, there was about 27 million records that were breached by hackers or other unauthorized efforts. So this is something that isn't going away. But we find, these are some of the common threads that we find. A, they failed to do their security risk analysis. B, they don't have proper policies and procedures in place. They're outdated. Those need to be updated within 3 years. That's something that an auditor is going to ask you for. Another one that was interesting that we'd see on a lot of these audits, and by the way, we have a track record, and I'm going to knock on particle board desk here. We have 100% pass rate right now. So we can help if you're in a mess, help pass those audits, but we find that the auditors are even asking to provide proof of HIPAA compliance training. That's a weird one, but why is that? We're finding a lot of the problems are the employees. They're clicking on those links. Hey, Amazon, you've got a new order. Do you want to track it? Sure, I want to track it. And they click on the link. Next thing you know, malware. So there's very important training. You see this holistic or this ecosystem of training policies, training again, repeating training, and making sure you're identifying the gaps. That'll put you in a good situation. What is the OCR looking for? So back in the day, and I just had a question. Yes, we will be providing a recording of the presentation to everybody that attended and also those that didn't attend. So we always ask our clients, can you send us the letter that the OCR sent you? There used to be Figliosi audits. There was state, Medicare, Medicaid audits. There's all different types of audits, but let's talk about the big ones. The OCR audits, what are they looking for? Documentation. Have you documented? Have you performed a security risk analysis? In the first several years of business, 7, 8 years ago, we would get into the conundrum or the debate with individuals, do I have to complete this annually? I say, well, I'll tell you on the flip side, if you don't do it annually and you get audited, you're going to get fined big time. So to me, this is an annual process, and they're becoming more and more clear on the frequency of monitoring data, patient records, making sure they're secure, and doing that annual security risk analysis. ongoing monitoring, business associates, have you identified who they are? Do you have an agreement with them? Do you know if they've done their security risk analysis? We are finding that a lot of breaches are coming downstream, through those, or upstream from business associates. And this is a frustrating thing for a physician to come in Monday to work and have to notify the chain of trust. The buck stops with the physician. So he gets to notify the patients, hey, of no fault of my own, I apologize, but our vendor had a breach, and so now I get to notify you. And it's just bad business. So make sure you have those business associate agreements in place to help with that. Now, we have a complimentary tool that we give you to help manage those business associates and ask for satisfactory assurances that they have completed that. It's called BAM, Business Associate Management, but that's complimentary. So anyone that wants that on the call today, it's yours. This is the question, barriers to achieving HIPAA compliance. This is what our clients normally say why they haven't performed their security risk analysis. It's time consuming, takes a lot of time, or we don't have the administrative staff, it's a burden. Manual process is what we saw back in the day. We see a lot more automation now, but spreadsheets, there's no way to involve a large group and keep those spreadsheets up to date and set auto reminders, emails, all that. It's a nightmare to try to do it that way. And I love when those clients come to us and say, we've been pulling our hair out for the past 5 years. We would love some automation. And that's exactly what our software does. I'll show you that here in a minute. They don't have the internal resources, tracking, reporting, and it is very, very complex for larger organizations that have 20, 30, 100, 150 locations, different tax ID numbers, different types of practices. So that's what the software, the complexity, it takes the complexity out of that and helps you manage it a lot better. So I've got another poll question. I love these questions, probably more than you, but here we go. So did you complete your security risk analysis in 2020? Now, I know 2020, it's becoming a distant memory for some. It was a nightmare for others, but did you get it done by December 31st? That was the deadline, amongst all the other things and changes that you had to deal with as an organization, because this was a big one.
Yeah,
so
and
go ahead.
Bobby, I just wanted to comment that I think the key word there is complete, meaning in both senses of the word, a complete and holistic one. And so we'll talk a little bit more about that later. A lot of folks do sampling, especially around their provider practices. They'll do 20 out of 100 or things of that nature. So complete and thorough, I think, would be two ways to think about this question.
No, great point. And this really will tee up the rest of our conversation, the response here. So let me close the poll and show the results. These are always, like I said, they're fascinating to me. 69%. So 70% of you, again, hopefully this is the same group, pat yourself on the back, give yourself a raise, and after we're done, take the rest of the day off. I approve it. The other 30%, I need you to stay on the call, and we're going to share some things that will help you get through this nightmare of a process. We get it. We hear the sob stories every year of how hard it is to keep the practice afloat, and we've got all this compliance nonsense that we have to do. So we are here to help relieve that burden. That's exactly what we do. So we had a question just come in that says, does it matter if the SRA is done by the calendar year versus fiscal year? So great question. It needs to be done within the reporting period. That's the key. So when is your reporting period? That's when they'd like to see that. However, most people wait, and their reporting period happens to be Q4. Everyone likes to wait until fourth quarter to do that. So we're really, really busy over the Christmas and Thanksgiving holiday. However, we do hundreds of assessments leading up to that. So pick a time, know when your reporting period is, and get that done. Next question that I'll tee up here. If you were audited tomorrow, those 75% that did their security risk analysis, if you were audited tomorrow, are you 100% confident you would pass your audit? So the Office for Civil Rights knocks on your door, hey, we're auditing you. Are you ready to respond? Are you 100% confident that you'd pass? And this is always a fascinating statistic that I'll share with you, and some of the whys behind it as well. So give a couple more seconds, let those poll numbers climb, and I'm going to close the poll and share it. So 30% of you, 33%, that bounced up and down between 29 and 34% as you guys were answering. I see the real-time responses there. 30% of you are not confident that you'd pass. And we always ask why. Why is that? Here's some of the things. We didn't have a framework. We're not sure what to do, not sure what state or federal requirements are being asked of us. We used spreadsheets last year. It's hard to track and update. Did we miss something? So again, as I mentioned earlier, our goal is to take that burden and stress and lack of confidence and put it on our shoulders so you don't have to worry. And again, we do have a 100% pass rate on those. So I think we have one more poll question in this little series before we get talking. I'm going to launch that right now. Was your 2020 SRA, just out of curiosity, did you do it internally? Was it done by an external assessor? Or we haven't really performed that. So answer that real quick and I'll display those results and then we'll jump into another topic. And then we have a question that I'll share with you as well. So I'm going to close the poll. 3, 2, 1. You got to be Johnny on the spot for these. And I'm going to share the results here. So 46 did it internally. I think that's where a lot of the insecurity is coming from. Did we do it right? Is that spreadsheet? Did I cover all the citations, the HIPAA citations? That's where a lot of this, like I said, insecurity is. External assessor, you're probably in good shape. Here's one of the challenges that I see. 36% of you did it externally. Sometimes the deliverable is a PDF. That's a bunch of hooey. It should be an active SaaS-based tool that allows you to go in and update. If the deliverable was PDF, it means you paid a little bit too much for that as you're going through the process, because there's a lot of manual stuff that goes on behind the scenes. You've got to picture TurboTax. That's the best way to describe our software. You can do your taxes on your own with a calculator and a spreadsheet, or you can use TurboTax. It'll ask you a bunch of questions and you answer them on the fly. So that's kind of what we do there. And then 17% have not yet performed it, an SRA. So we need to talk to that group because you need to get it done every year. The fines are not small. They're about $50,000 per infraction. And again, we're not trying to scare you. We don't use fear as a motivating tactic, but this is, do not check a box if you're participating in MIPS or any of these other programs that you've completed your assessment, or if you get audited, you're signing your your death wish and your fines at that point. So Mike Gross, Mike, good question here. So SRA recommendations for nonprofits that are limited because of budget and restraints, budget constraints. Back in the day, I used to say, go use the OCR SRAT tool. Problem with that is the big disclaimer on their front page. I know who built it. I know how much they paid. I've met with her. Great lady. You will not pass an audit. This is not intended to help you pass an audit. This is for informational purposes only. Okay, first, strike against you. Second is it doesn't calculate your risk. You have to assess your risk, high, medium, low. And the third thing, it doesn't write your report. There's no ongoing remediation. So back in the day, some of the nonprofits, I'd say, go do that, get done, and at least check the box. And it's free. I call it free like a puppy. Puppy, there's food, there's shots, it chews up your couch. There's a fee associated. Don't get me wrong, nothing's free in life, but at least it doesn't cost you anything out of pocket. I don't recommend the product anymore. And if anyone was on from the OCR, I'd say you need to update your own product. Eat your own dog food. This is something we stay on top of these state and federal requirements. And the second we see them come across, they're changed in our software. So you'll see these questions evolve. 7 years ago, they're a lot different than they are today. Mike's question, we have thousands of FQHCs, nonprofits. We have nonprofit discounts that we can provide you so that it is affordable. And I guarantee you're spending more in time and manpower and labor and dollar cost per hour than using software to do it. We try to make it very, very reasonable in terms of including your assessment, and I'll show you some of the things that we include in that'll answer Mike's question here in a minute.
Hey, Bobby.
Yeah.
Real quick, just to sort of put a fine point on it, as far as the OCR readiness within your platform, within the HIPAA One platform, it really is, you've really baked in the OCR audit protocol within the workflow of the platform, right? That is how you can
Absolutely.
sort of create that assurance. Yeah, great. Thank
Yeah,
you.
that's where the confidence comes from, that you answer the questions, that's where we can guarantee you'll pass your audit 100%. And we've never had anyone fail an audit, and had lots of OCR audits, lots of Figli OC audits. They know who we are. And I think we get a rubber stamp because they know we're ahead of their own compliance tool that they have. So I'm going to speak in, those of you that are about my age, remember the Micro Machines commercial where the guy talks really fast at the end, all the T's and C's. I'm going to do that here. We're going to blaze through some stuff pretty quick, because you're going to want to hear the stuff that we talk about at the end of the discussion based on how you responded, who's on the call. We've got some good information that we'd like to share about your organization and how you can put some of these things we're talking about into practice. So understanding HIPAA compliance and your responsibilities, it is such a foundational piece to your cybersecurity initiatives. It identifies risks. Now that you know what those risks are, you can now put a corrective action plan in place. Here's your roadmap for the year. And again, if you remember what I said earlier, identifying your gaps, putting a plan in place, you are now HIPAA compliant, even though you haven't done anything. So that's why that first part and that first piece is so critical. Well, how long is that going to take us? I'll show you. That's what we have here at the end. I'll show you how long and what you need to do. The other advantage of the software is these ongoing updates and being able to invite delegate up to 10 individuals to respond to questions and go through the security risk analysis. So what are the triggers? I'm just going to hit high level. A breach, you have a breach, you have to report to the local media channels, all your patients, and the OCR. This is not something you want to bury under the rug. So once you do that, you are going to get audited, just so you know. Merit-based incentive programs. So the MIPS program, meaningful use programs, this is important to know that it is not part of the ACI score anymore, this thing called the HIPAA Security Risk Analysis. They moved it to the very front. So it is a prerequisite. And there was a big article that said, hey, it's not, the HIPAA risk analysis is not required anymore. And I thought, oh, awesome, we're out of business. And then I continued to read the article. It was a very catchy title, but it is now a prerequisite. You have to do a security risk analysis if you're receiving reimbursement money. So that's something that's important for everybody on the call to understand. What are your responsibilities? Get it done, regular security risk analysis. Get your corrective action plan in place. Get policies and procedures. If you don't have them, we do. We'll give them to you. It's part of the software. Make sure you're documenting all efforts related to HIPAA compliance. This is an important part so that you can produce those in the event of an audit. We find a lot of people are strong on the policy and procedure side, but don't document. Make sure you're keeping track of this. And depending on the size of the organization, a lot of our nonprofits, you have an administrator wearing the HIPAA security officer role. Whereas in some of the larger hospitals, they have several designated HIPAA security officers. That's all they do. And then business associate agreements, make sure you get those signed, make sure they're secure. You do not want to breach through one of your partners. All right, well, that was quick. Question, launching, need you to answer. Do you have all your business associate agreements in place for all your vendors that can be accessed in one location? This is a trick question, just so you know. but I want to have you respond to that. Can you access, if I asked you to get that today, is that something that you could produce? Give 1 or 2 more seconds and we are going to close the polls. So interesting spread on this. This is, I'm not going to say this is a smarter group because that wouldn't be nice to the other groups that have come before you, but this is a more HIPAA security and privacy advanced. This is, let's call this the AP class, and good pupils, 4.0 valedictorians. 56% of you have all your business associates accessible. This is impressive. We don't usually see that. The other, 23% no and 21% not sure. And that is the normal response we get even to this day. It's just not something, unless you're utilizing a software to do it. A lot of people are using spreadsheets. That is a very labor intensive and mundane process. So as I mentioned a little earlier, we have a tool. If you're of that additional 50%, we have a software we'll give you that'll allow you to track that. It incorporates workflow automation, electronic signatures, and everything else that you need to get those business associate agreements managed. Okay, so here's the approaches for performing an SRA. How do we do it? This is the biggest thing that we see. I'm not sure how to do it. We see internal processes, spreadsheet, the SRAT tool, sometimes external assessor, somebody you've paid to come in, they sit down, they interview you, and then they send you a big fat bill and give you a PDF, which is so 1990s. Software assessor and assistant. So these are the different approaches. What we want to do is provide you with an approved framework. It's performed by subject matter experts. These are certified auditors that are helping hold your hand through the process, and then you use software to simplify, automate, and scale those processes. And we can do it in a couple different ways. There's a self-assessment, facilitated, or validated. And the difference between these, just at a high level, so we can get to those last slides. Self-assessment, it's kind of a do-it-yourself. Here's the TurboTax software. You'll have a kickoff call, but answer the questions at your pace. The other two, the facilitated and the validated, you have an auditor holding your hand. It's a little bit more expensive, but they're holding your hand through the entire process. They're reading your policies and procedures. They're verifying, are they up to date within the past 3 years? Do they meet the standard of today? Are they updated? Are they, so those are some of the things. Do they meet the state and federal requirements? Those are some of the things that is the advantage of having an auditor at least year one do. We can get you pricing very, very quickly for some of the smaller nonprofits. All I need to know, how many locations do you have? Is it 1? Is it 100? How many employees? That gives us an idea of the work that needs to be done. How many EPHI systems? These are your RIS, PACS. Depending on the type of organization, you may not have a RIS and a PACS system. So what are those? What's your EHR software? Are you a business associate? You don't have EHR software. And then what type of assessment? Once we get that data, very quickly, within a few minutes, I can say it's going to be a couple $1,000 bucks. You know, it's going to be $20,000 bucks. I can tell you based on the size of your organization, you know, what that's going to look like. So using HIPAA 1 to complete your SRA. So Vikas, what do they need to look for in software?
Yeah, so you know, enterprise health had traditionally come from the consultancy space, and now we really leverage the HIPAA 1 platform for all the security risk assessments, the HIPAA-based security risk assessments that we do. And one of the fundamental reasons we wanted to make that strategic acquisition in the marketplace was because this need to be comprehensive and to scale. Some of the points that we talk about here, I think, are really, really key. So the ability to wrap the OCR audit protocol within the assessment process in software, the ability to see the references not only to HIPAA, but also to NIST. As we saw today already, so many of you have adopted frameworks. My guess is that a large percentage of those are either NIST or HITRUST, and one or the other, whichever one they're using, you know, we say, you know, use a framework, any framework, but use a framework. So whichever one that's that you can make that sort of linkage and analogy to. So a lot of the ability for us to really do this in a scalable fashion, and we've kind of, you know, in this audience here today, we've had to kind of talk to 3 different sort of segments in the marketplace, and we're going to talk about really complex, large organizations coming up here. But this really allows scale, and I'll hit on that last point that I made previously, which is the ability to do all of them. So typically when we would engage from a services perspective, we would talk to our client health system, let's say, and that had 50 practices that they owned. Well, for budgeting reasons and or time reasons or resource reasons, we could only sample 10 of those. The ideal is to do all 50 because you truly want to understand all of your risks and your complete risk profile, but you have those limitations. With a software like this, it allows you now to do 100% of that continuum, which ultimately you want to understand your full risk profile. So those are some of the risk differences that obviously we're seeing the bullet points here that I know we want to talk about later.
Thank you, Vikas. So let's talk about the process. What do you do? So step 1 of any security risk analysis, whether you're using spreadsheets, an audit, or whatever, there's questions. You've got to answer these questions, and we break it down into different roles: HR, IT service, So you've got network and service manager, you've got HIPAA security officer and facilities manager. So this helps us identify who is going to be answering the questions. The red and green Christmas colors you see on the screen here represent how far we are relative to answering the questions. So HR, 100% complete. You can see HIPAA security officer hasn't even started. They're on vacation right now. So that gives you a good at a glance, as far as progress. Let's talk about the specific questions. Let's dive into the question. We're not going to read any of this, but this is the HIPAA citation, this area in gray. And we put it in gray intentionally. It's up for, interpretation, if you will. So on the left-hand side in black and white is our interpretation of what's being asked here. And again, the fact that we have 100% pass rate, we've done this a lot of times. We know how these responses need to look. But this one, does the organization have policies and procedures or formal process where HR notifies IT staff of terminations, departures? This is a funny question because we'll ask HR this and they'll say, absolutely. And then we ask IT the same thing. Hey, does HR notify you of a formal process where you're supposed to revoke access? And they'll say no. Boom, red flag. So HR thinks they're doing it or not doing it, and IT says, yeah, we don't. That would be, there have been several cases where unauthorized access has happened by a former employee. Terminated, they still have access to the software. That is a breach. So you want to be careful there. But bottom line, I wasn't going to go too granular into that, but you have the option to answer, yes, we do have this policy. You click on yes, and this little dialog box right here pops up and it says, prove it, upload one that you have within the last 3 years. So you say, sure, boom, upload, attach, move to the next one, Bob's your uncle. So we've got that one done. What if the answer is no? What if we don't have that policy? How bad is that? When we first started, we found a lot of our clients were embarrassed to answer no. And so they would answer yes and try to remediate as they go. Please don't do that. Be honest, answer the questions. All it's doing is identifying your gaps. And if you remember, you're not penalized for a no answer. It's actually the opposite. If an auditor came in and you answered yes to everything, we have everything, they're going to start digging and they will find something. So just be honest. This one is, do you have this policy? No. Look how the dialog box has changed. Not a big deal. Click here. Here's your policy. Boom. So it's right there. So that's if you answer no. What if those questions don't apply to you? We're still going to ask them, but you say, you know what, this is not reasonable and appropriate for our circumstances. NA is not applicable. It's not reasonable and appropriate for our circumstances. Why? Explain it. We're a business associate. We don't see patients. This has nothing to do with HR, terminating staff or whatever. So you just give us an explanation in there. Our auditor reviews that and makes sure that that response is satisfactory. Once all the questions are answered, we now move on to step 2. This is phase 2, is the remediation planning. So we click on this button and I'll show you just a couple quick features here. It maps the risk, the threat, the vulnerability. So you've got all that done. You can add any compensating controls here, but this is the part I love. You can see the action plan down here and you can customize this, but this is going to tell you exactly what you need to do. Assign the role of HIPAA security officer to an individual in the organization who maintains policies and procedures, blah, blah, blah. That is critical that you identify a HIPAA security officer. If you're a small organization, again, it's an individual wearing many hats. If large organization, that will be a specific role. But the benefit of this piece of the software right here is I can assign an individual, Steve. All I need is the email address. I put a target date and it creates what I call the auto harass feature. It's going to ping Steve and say, hey, Steve, guess what? You got 5 high-risk items that need to be addressed. Get on it. You have until September to do them. It's June. You got some time, but it's going to continue to harass him. You don't get that with spreadsheets. This is one of the biggest pieces, the question answer. We take this for granted, the calculating of the risk, and then also this automated reminders. Our clients say we love that piece of it. I've got a few things I want to show you coming up here as well. Step 3 is these graphs here. Current risk status, high, medium, and low, what's unaddressed, open, and resolved. I can add a reviewer. So this might be the physician, didn't help with the security risk analysis, but wants to see where the organization is from a compliance perspective. They can log in. All I need is their name and email address, and they can say, okay, here's our current risk status. All right, here's the risk updates. So we did 2 in November. We took December off. We added another one in January. This is good. so you can see progress there. You get a letter grade. The letter grade is based on your responses and will increase rapidly. But it's just kind of only you see it, the auditor doesn't see it, but it gives you representation of where you are. The final piece is the action plan and the viewing of that report. So this is the action history. Look at printing the final report as a snapshot in time. That's a picture. The action history, this is ongoing, living, breathing, this is movie. So this is where you come back in 3 months later, and it's constantly you're updating. And so you would come in here, your action for this policy, you put some information here, Sharon will complete this, sign off on it. Once I click risk remediated and add that, and I can upload any files here, it will update all those graphs that you saw prior. So those are the steps, and then it does produce this final report. It ends up being a 50 to 150 page report. We can, custom label these if we want. So here's the question. Everyone says, how long is this going to take me? So this is key, and then we've got our slides, our last few slides here next that'll talk about larger organizations. So how long does this take? 30 minutes for the HR director. You've got 9 questions. Now, do you need to answer them all in one sitting? No. So you could answer 10 minutes today, another 10 minutes tomorrow. But we've estimated doing this with over 8,000 client sites every year for the last 8-9 years. It's about 30 minutes. IT network and server. This one is a little bit more time intensive. If you have internal IT staff, you can delegate this. That's about 30% of your security risk analysis. What if you're smaller? What if you're a nonprofit and you don't have full-time IT staff? This would be your managed service provider who helps you with your, when the computer breaks, who comes and fixes it. That's who you want to target for that piece. And then you have the facilities manager and HIPAA security officer, bless your heart. You're about an hour and a half of questions. There's about 24 to 26 questions, depending on how you answer. We may ask a couple of additional questions. And then depending on the size of your organization, for every 1,000 employees, you can add another 10 minutes. So we've learned how to scale this with some of our larger organization. So this, oh boy, this is very complex, but we'll try to make it very simple. Small to medium size organizations. We have the ability, it's called active templates, the ability to pre-populate or create a template on a corporate level. And it's customizable, dynamically updated database. It's kind of a representation of an assessment that you've done and the current controls for that organization. That template can be pushed to different organizations within your organization. So let's say you have 10 locations. We can create a master template and push those out if you're following the same governance, risk, compliance, policies, procedures. So very, very easy to do, huge time savings there. What if we're a complex organization, really, really large, many unique locations, different tax ID numbers, different types of healthcare? One might be a clinic and the other might be a pharmacy, and just a mix of organizations. Super easy. Under one pane of glass, we can set these up by tax ID and do a similar process with this active templates feature, where we can pre-fill information and then push it out to organizations. Now, let's say from a global perspective, only 3 of the governance and risk compliance pieces are consistent. Great, let's answer those 3 questions. It's 3 less questions that they have to answer. To give you an idea, in December, I wasn't going to share this, but in December, we brought on a client December 1st, and the contracting process took several months to get approved, but they had about 340 locations. So I thought, we're hosed. Goodbye Christmas break.
And 12 hospitals, right, Bobby? There was 12 hospitals.
Yes, quite a few. It was a big one. We were able to complete that in 3 weeks. And again, when I say 3 weeks, the auditors roll their eyes and go, yeah, it was nights and weekends. And bottom line, that's a huge organization. If you're smaller than that, you're not very complex. But they had hospitals, hundreds of clinics, different organizations within that health system. The advantage, it's not that we're superheroes, it's that the software enables us to do some pretty cool things and pre-fill to make it a lot easier. So that's what we address is we audit headquarters, build these master templates, and then push them out to the other organization. So it makes it very, very easy to use. I'm just going to load all of this so that you can see the little ecosystem here that we just talked about. This is the template. You know, your master template, you push or you open your security risk analysis or privacy. The nice thing is the group that you involve can go through and validate that those answers from the initial assessment are specific, you know, to their organization. They may say, yeah, that doesn't really apply, and they can change the answer to something else, or say, you know what, we have a little different policy in how we do things here in rural Texas versus, Ohio or something like that. So, Vikas, anything you want to add here before I move on?
Well, I was just going to say that I think this is such a key feature, and this is what really I was alluding to earlier, the ability for the capabilities within the software to allow us to do a comprehensive and thorough job across longitudinally the entire health system, or payers and larger business associates and other organizations. I think this is just a fantastic feature that applies to so many of those folks.
Absolutely. We had a question come in because it says, hey, do you have a crosswalk between the HIPAA 1 SRA and the OCR and NIST frameworks? So the answer is yes. The HIPAA 1 software is based on the OCR's audit protocol and references all of the NIST citations and the HIPAA citations, both on a state and a federal level. So that's exactly what the software is. Again, it's like doing your taxes. First question, what state are you in? State of Utah. Great. Boom, here's your template. How many kids do you have? You know, do you own a house? Do you rent a house? So you start answering the questions and it builds out and tees up. It's, as I mentioned, a reflexive questioning engine that maps to those frameworks. I can probably share, we have a NIST framework tool that has not been released yet that is specific to the NIST framework, and some of the, organizations, risk appetite, cost associated with that. It's a new tool that we've been beta testing with some of our clients. So if you're interested in that, we'd be happy to give you a peek at that software.
And Bobby, I think one of the really appealing things about the HIPAA 1 platform is how you've really taken a comprehensive approach to HIPAA compliance, and of course done in a scalable way because of software, but where you have HIPAA security addressed, you have HIPAA privacy addressed, you have the OCR audit protocol addressed, you have all the breach notification requirements addressed. You've got LMS so that workforce training can be provided on the platform. And now you've got the business associate manager to really, it's one-stop shopping is the way I think about it in terms of your full HIPAA compliance needs, and done in an incredible scalable way. Your example of that one organization doing 300 practices within 3 weeks is just, mind-boggling. That would, on a consulting services basis, probably would have taken us 6 months to 9 months to do all of those practices. But so the comprehensive nature of the platform, I think, is just really unique.
When you list it, it is a lot. We didn't have this 7 years ago. It just took a lot of money and a lot of blood, sweat, and tears, and bumping and skin on our knees, and a lot of awesome clients. I mean, we've learned. The thing I love about our clients, once they're with us for a long time, and we get to know them. If you ever come to Utah, you need to hit me up. We'll go skiing. I love skiing, mountain biking, all that fun stuff, but that's a side topic. It's important. We get a lot of our feedback from our customers. What would you like to see? That was the inspiration for our business management tool. One of our large clinics that had hundreds of locations, I said, how are you managing your business associates? And the lady said, oh my gosh, it's a nightmare. I pull my hair out. It's spreadsheet and I have no way to organize it. And I said, well, could we build you a tool? Let's experiment. So we helped build this tool a couple of years ago, and now it's available, and we just give it to you. It's like, here it is. We incorporate workflow, electronic signatures.
Over 700 customers and 10,000 assessments later, you can tell all these war stories, right?
Absolutely. So closing up, thank you everybody that has joined us. I've got one final poll question here that I'd like you to answer. We talked about a lot of stuff today, and a lot of people are here for continuing education. Awesome, that's great. If you're interested in comparing what we do with what you do or have done, security risk analysis, you want more information, pricing. Are people non-salesy, non-pressure? They can give you pricing for your organization to evaluate if it works for you. For nonprofits, we've got thousands and thousands of FQHCs that say, thank you, thank you. You know, this is awesome. It helps us. And we try to throw in everything, including the kitchen sink at a very, very minimal price to help you out. Privacy and breach, interested in that. HIPAA compliance training. While you're answering, I'm just going to talk through some of these. HIPAA compliance training we can customize for your organization. We can make it your custom training you can build on this LMS platform. We spend a ton of money on that. So if you want to just use out of the box, click this. Here's a quick physician training, 15 to 30 minutes, you're done. Or here's my general workforce training. I want them to learn a little bit more about the history of HIPAA, you know, email phishing, you know, or if you say we have our own content, we can help build that out. Remediation services, this is one of my favorite things about being acquired by an organization, Enterprise Health. We started out back in the day, you know, bootstrap, no private equity money, and we had a lot of people saying, we want to buy you, we want to buy you. We waited until we found the perfect partner. They do what we don't. You know, they do a lot of the high trust. A lot of these remediation services, we didn't have the bandwidth to do that. We had really cool technology, and it's been fun the last 6 months to marry the two organizations, and it's been an amazing ride. Most acquisitions don't go well. It's been a lot of fun. So I'm appreciative that they bring this remediation services piece to the table. So anyway, thank you for your attendance. If you have any additional questions, usually we take them as we go, but if you have any additional, let us know. I'm seeing one about HIPAA 1 through NextGen, haven't been contacted by anyone. So we actually have partnerships with NextGen, Athena, Advanced MD. I mean, a lot of the major EHR vendors that provide discounted pricing. So we will have somebody reach out to Miriam and figure out, you know, how we can help you there. So anyway, a lot of content. Thank you for your patience. If you have any additional questions, even if you're here for educational purposes and want to understand a little bit more what's going on in your organization, please reach out to Enterprise Health or HIPAA 1, and happy to help you. Vikas, always a pleasure. Hope
always. Thank you.
Been a fun ride. So thank you very much, and hope you guys have a great rest of the day.
Take care, everyone.